The CDC director just said yesterday that it's not quite time to drop the mask rules. You've repeatedly said that you're going to do safety first, and I know other states are doing it as well, but does this fly in the face of that if the CDC director is saying, hold on a minute?
So I'm not familiar exactly what they said today, but I know that we're through the Department of Health and in the state that we have such high vaccination rates. If you're talking about public masking, I think it's time that we go to personal choice. I think that most people in the state of Rhode Island would agree to that. As far as the schools, we're set the March 4th date, and we're going to, continue to take a look at the trends. And if there's ever a reason, as I've always said, to reverse or to go back to a more stringent strategy in the schools in particular, or in the general public, we will. But right now, we feel very comfortable where we are.
And this question actually is for the commissioner, if you don't mind. So what do you tell schools that have lower vaccination rates, particularly Providence, which the state controls? What do you expect to happen in Providence when the state mandate gets dropped? Would you keep the mandate in Providence?
Well, we're not there yet. We're here today, right now. And today the vaccination rate in Providence is 32%. What I would say is that parents need to get their kids vaccinated. Right now where we are today, we're keeping the masks. I don't know where we'll be next week or the week after. We've seen it drop. But right now, this is where we are. And I'd like to take this opportunity to say to families, the vaccination rate in Barrington is 78% in the schools. It's 32% in Providence, 31% in Central Falls. We have to do better. Y a los padres latinos le quiero decir, le dije ahora en inglés, que en Barrington es 78, en East Greenwich es 78 el porcentaje de niños vacunados, pero en Providence y en Central Falls es 32 y 31%. Señores, les suplico, busquen información de una fuente que les pueda explicar qué son las vacunas. Ustedes lo vacunaron, a nosotros nos han vacunado, tenemos una historia de eso. Por favor, la comunidad de nosotros necesita unirse y entender los datos. Por favor, 32% va a asegurar que nosotros sigamos en esta pandemia. Necesitamos unirnos.
With February vacation coming up, as you mentioned, the Super Bowl, why did you decide to pick March 4th? There are some parents concerned that there could be spread or community spread among students with the vacation.
So March 4th was a date that we arrived on with the Department of Health, along with, as I mentioned, the long list of people that we've talked to from RIDE, with the commissioner and her staff, along with superintendents, school committees. And we felt as though that March 4th was a date because to go a full week after the winter break made a lot of sense to determine, making sure that we were in good shape.
And secondly, did you coordinate with Governor Baker on this announcement? They decided February 28th, but what's your communication there?
Yeah, so we've had communication with Governor Lamont, Governor Baker. Yes, I was in communication this week. I knew that he was going to be coming Wednesday, and we tried to align our announcements in a way that showed that there was a regional effort. Our states are very similar on vaccination rates. Our states have really led the country. New England has, and Massachusetts, Connecticut, and I really appreciated their support during the time frame when we were at, making sure that we were hitting levels that we weren't at when I became governor. So yes, we did align, and we have had multiple conversations over the last week and a half.
Governor, might you change this guidance, or if cases persist or start to rise after the school break, reinstitute a mask mandate?
That's not the plan right now. Based on what we are projecting and based on what the Department of Health is feeling, as though we're in a rapid decline at the moment, and we just need to make sure that we continue that way. As I said, we're always open to, to make sure that we're responding to a situation that we're not anticipating right now. But right now, we're not anticipating. We're anticipating that March 4th. At the end of the school day will be the time frame that the local districts will decide. And we also are working, I'll add in, because a question was asked last week with the Rhode Island Scholastic, we're working with them as well as the Department of Health to talk about the sport events as well and accommodating the masking for competitive athletes right now in terms of making sure that they're competing in a way that the Olympics is competing.
Do you have a date where you anticipate making an announcement regarding sports?
I think it's going to be aligned with the March 4th.
Okay.
That's where we are right now. There's no announcement there, but that's the anticipation.
Governor, what happens if, say, a district like Central Falls continues to have high positivity rates but wants to go mask-free? Is there some point where you intervene, or is it totally up to the district?
Well, in Central Falls, the state certainly does have some say in that. We're going to use the next several weeks, several days to do what I asked would have be done back before Thanksgiving, which was really to double down on the boosters. I think that we can do a lot more than has been done, and Dr. McDonald has made that a priority in the Department of Health to really get out and start re-educating people of the value of the vaccination and the value of the booster. And as the Commissioner said, RIDE is going to be, the districts that RIDE have direct management in and responsibility for will be working with those, the people in the district and making determination as we approach March 4th.
Governor, just curious, how often you've had dialogue with the Interscholastic League about the mask issue? And I know I'm sure you've seen the photos, a lot of kids not wearing them properly and things like that. Is it just maybe simply it's time to just do away with it in terms of competition?
Yeah, so we've been in touch with Mike, Executive Director, and we've had conversations with the Department of Health. Right now we're moving towards the March 4th date, as I do believe that you need to bring in as many people as you can that actually are managing the situations to get their input. And right now, my understanding is that we're headed towards a March 4th. If that changes, as soon as we know for sure, we'll make an announcement on that. But those discussions are ongoing right now.
Hospitals, what is the status of our hospital capacity right now? And are you considering lifting either the legal immunity for hospitals or the vaccine mandate for healthcare workers?
Yeah, so on the immunity, I'm not going to re-sign that. That's going to sunset. Visiting the hospitals and talking to the hospitals, you know, they feel as though that they're still challenged on staff to a certain degree, but that they feel as though that the worst is over, at least what I'm seeing, subject to change always, but that's the message I'm getting. So we'll continue to work with the hospitals on the staffing, which is the main issue. And again, when we start that there's a certain percentage of the hospital capacity, let's understand that a hospital like Rhode Island Hospital is working on around 65–70% of their total capacity. So if we're at 95%, we're really at 95% of 65%. So there is room to grow that capacity, and we're working with the hospitals in many different areas to increase the staffing. And our anticipation is that you know, the workforce is going to come back to work, and they're going to continue to grow their staff as they need to. I'm praying that they're going to have less and less reliance on traveling nurses that are paying 4, 5, 6 times the price of somebody who's working next to them. So I think that all in all, the hospitals have indicated to us, and we let the Hospital Association know that I won't be renewing that indemnity clause.
And the National Guard and the federal assistance, do you have a timeline for that? When that's ending?
Yeah, I think it was. I think we were at 30 days. I'm not sure when that's expiring, but we're coming up against that. And then, the same thing with Kent, got an extra 2 weeks. So I think we're probably sitting on 10 days or so. That's still remaining on that, 10 to 14 days.
Governor, in the fall, when you announced the mask mandate, it was across the board. Now, on March 4th, it's now kicked to everybody and they can make their own decisions. So my question is, why isn't it just across the board? Why are we a week after Massachusetts? And last week, 400 parents came to the State House to testify to remove the mask. Did that have any impact in your decision-making?
Well, I think again, the health issues and the Department of Health, we wouldn't be moving forward unless they were, you know, feeling as though that we were doing the right thing. So, and of course, we listen to all parents. We listen to the hundreds of parents that are contacted us that want to keep their kids with masks, right? So we filter all the information. I don't discriminate against anyone who's given a position either that's aligned with where I am or not aligned where I am. So I think we take all the considerations. Today's announcement is based on that good data and also the input that we're receiving from people who are managing. Back in August, if you recall, I was not quick to do a mandate in terms of the school maskings. I wanted the local school districts to talk about it. And I think it goes unnoticed, but 90% of those school districts at that time adopted a local school mask protocol. So now I feel comfortable that they did the right thing then. We're several months away from that right now. What was potentially, the correct thing to do then doesn't necessarily mean it's the correct thing to do right now, right? Things change. So I have confidence in the local districts, just like I have confidence in local municipalities to make good decisions.
Adorable metaphors aside, parents are angry. Discovery, it was announced today in the case of Southwell v. McKee, has been delayed again, coincidentally, until after the mask mandate is dropped, wondering if that's a coincidence or not. Hundreds of angry parents made phone calls in testimony this past week against the extension of the federal order. And on top of that, there's more than anecdotal evidence that parents are engaged in a concerted effort to leave their school systems before the census date, which ultimately impacts the school funding formula. That aside, my question, Dr. McDonald testified in Superior Court that evidence for medical interventions like masking, these type of controlled trial data is effectively the gold standard. I believe that was his words.
Pat, I'm trying to get the question, so
I know.
if I don't answer it directly, I mean, it's not because I'm evading it, it's that I just forgot what you asked, at the beginning of the question, so.
Governor, parents aren't amused by the cavalier attitude this administration takes to fundamental civil rights. That was displayed this week. Is that?
Yeah, so I think
Dr.
that
McDonald testified in court that these trials
Yes.
are the gold standard, yet at the same time, the question is, did he present to you during your administration or the run-up to your administration any of the trial evidence which refutes much of what you're talking about today?
So I think I answered that when John asked this question. What's happened in August and what's happening today, look, I happen to be someone who wants to get it right. I don't have to be right. There's people out there that want to be right rather than get it right. So just because it was the right thing to do at the moment in time we did it in August doesn't mean that we're not responding today to do what's right by the people in the state of Rhode Island. And we know that, yes, there was a strong group of people who said that they're tired of it. I mean, I think that represents everybody in the state of Rhode Island. We're tired of this virus, and we need to respond accordingly. But also, you're going to see, in the same respect, you're going to get many, many families who are going to choose to have their kids masked when they go to school. I'm confident of that as well. So there's a difference of opinion. Not everybody agrees on any one opinion, but in the end, we have to make a decision, and I think that we base the decisions that we made today based on good data and also listening to the people in the state of Rhode Island and responding to their, to what they're talking about. So.
For Dr. McDonald.
Yes, good.
Last month, in the beginning of January, the Federal Center for Medicare and Medicaid issued a directive that requires private insurers to cover up to 8 tests per person, rapid tests. And they recommended people could go to pharmacies and obtain these tests. We tried that, and we discovered that all the major chain pharmacies we went to have a policy that you can get the test, but you have to pay for it up front and then seek reimbursement. And for a $12 item, these can be multi-page forms and quite a lot of hassle. And I'm questioning, A, whether people would do that, and B, whether people who are most in need, Medicaid patients and so on, are unable to pay up front and wait for the reimbursement process. So on January 21st, we queried CMS, and we asked what their position is on this. And they said, well, states can do that if they want to do it that way. But what they recommend is that states issue a standing order prescription, basically applying to everybody in the state, so that, in effect, there's like a prescription for everyone who walks into a pharmacy and says, I want my rapid tests. And then that allows the pharmacy to turn around and bill the insurance company.
And we asked the Department of Health, who replied on January 24th, that the Department of Health was looking into doing that and creating a standing order. But we've seen no action on that, and I'm questioning where the state stands on that policy, because obviously it's a ton easier for people to walk in to a pharmacy and just charge the test directly to their insurance like they would with a prescription drug, especially for poor people and Medicaid patients who by definition are poor. So where does the state stand on that?
Yeah, so I agree with you completely. By the way, like if you have to go into a pharmacy and pay for something and then try to get reimbursed for it, like a lot of people just aren't going to go through the hassle. They're just going to, get stuck with the money. And for most people, that's just a barrier, right? So after you asked us, I actually contacted Commissioner Patrick Teague at the Office of Health Insurance Commissioner, and he's worked with the major insurers. Now, I don't know if you've checked recently, and I will follow up with Commissioner Teague later on today, but he assured me the major insurers in the state were doing direct reimbursement. Just so you know, we have drafted a standing order. Just so people know what a standing order is, a standing order means it'd basically be a physician order with my signature at the bottom. That means if you go into a pharmacy, you can get up to 8 tests a month, and all of a sudden, there you go. Your insurance company bills a claim, but I'm the doctor. And that's something we can do, but quite frankly, we thought we could do it a little bit more efficiently. So I'm going to follow up with Commissioner Teague this afternoon. I'm probably going to work with the Chief of Pharmacy in the Department of Health, Peter Augusta, as well, have him query the pharmacy chains as well, and just see what they're doing and why they're doing it, because what I want to do is the same thing you want, right? In other words, no barriers, let everybody get their tests, and no hassles. So that's what I'd like to see. So I'll work on it. Thanks for bringing it up to my attention. We'll work on it again. Yeah, I think masks are very effective in schools, and masks have been effective, and I think they've worked out well. I think what we're doing is giving the schools the authority now to just make up their own decisions. The case counts are dropping. March 4th is a date that, it's not magical, but when you look at our models, we think we're going to be in much lower prevalence by then. The Centers for Disease Control and Prevention broke it up into low, moderate, substantial, and high prevalence. It's predicted by March 4th, we have a pretty good chance of being at moderate, less than 50 cases per 100,000 per week. That's our modeling suggesting that. But school districts are going to want to look at that information before they make their decisions. In my humble opinion, that's what they should do.
What will be your strategy for the Latino community in Central Falls and Providence when you have two irresponsible mayors, both Latino and both school departments controlled by the state, to get the student vaccinated? Because we put the information in Spanish, and they think it's a joke sometimes, those two mayors. So you are responsible for the whole state. Whatever happened in those two cities can spread to the whole state. What strategy you have to bring information to the Latino community?
Well, I think it's getting your feet on the ground, and we did that. Mark Pappas and I, Director Pappas and I, got and straightened out a problem that was directly had to do with vaccinations in Central Falls. I want to thank Mark for that. I'll do a sidebar. I went to Smithfield this weekend, and I got my, and I think you were there, Ray, right? I got my rapid test, I guess that we'd call it, and a PCR test at the same point. Within a half hour, I had my rapid test. Within 24 hours, I had my PCR. So, Mark, thank you for, stepping up as you did several weeks ago to kind of, bring a little bit of, organization to that issue. But yeah, I mean, we need to step up into communities. I think community leaders as well. I think the parents need to step up as well. We're definitely going to be in the back end on an all-out effort around the entire state, including areas that are slow, have been slow to get vaccinated, which we know, as was just described by the commissioner, that Providence is one, Woonsocket is one, Central Falls is one. So we're going to go and ask them to do the right thing. We can't force people to do it, so we're just going to continue to ask and put the effort in. That has happened. Mayor Rivera has put an extraordinary amount of work in that district. If anybody has the solution, we'd love to hear it. All we can do is continue to go out, get our feet on the ground with the people that live in all the communities, and in particular the communities that we believe need to get more highly vaccinated, because as you said, the state is one state. And all 39 cities, what happens in one community impacts the other community. So thank you for asking the question, and we're going to keep on, working as hard as we can to keep people safe in the state of Rhode Island. And part of that is to get our students who are eligible to get vaccinated. Yep. Okay, thank you.